Is that good enough? Good enough. What is this? Come on, we gotta make this kind of look pretty. How's that? Okay. Hey everybody, and welcome back to my channel. If you're new, my name is Alyssa. You're watching Alyssa All Day. I have a watch problem. I wear 2 watches. Don't worry about it. Today's video is basically going to be a recap on my first month as an operating room nurse. If you don't know, I graduated in December of 2018, started working as a med-surg nurse in January 2019, and in August of 2019, I accepted a position and started in the operating room as a circulating nurse. I asked on Instagram. You guys can follow me on Instagram. Get a lot of my inspiration from my videos on there, do Q&As, all kinds of stuff. So if you're not following me, make sure you are. But I kind of threw a post out on Instagram saying, hey, I'm gonna make this video, or is there anything specific that you guys want to know or you're curious about? I got a lot of replies already, and I just posted it like 2 hours ago, so I kind of went through, looked at what the most common themes were, and I'm going to kind of discuss them in a more general sense relating to my first month, and then at the end I'm going to kind of answer a couple questions that don't necessarily fit into my personal journey, if that makes sense. So without further ado, let's just jump into this bad boy. All right, so the first question that I'm going to kind of answer is, I've been getting a lot of this, is how I decided to go into the OR. Honestly, I've always known I've wanted to be in healthcare, and I really didn't ever kind of think I was gonna go into the OR until I kind of started looking for day shift positions. When I was in the cardiac ICU, the pediatric cardiac ICU, I was able to watch bedside procedure. There were cameras in all the rooms, so I was able to watch that on a camera, and I loved that. When I was younger, I loved watching like Dr. G, medical examiner. For a long time, I thought I wanted to be a medical examiner, but you gotta go to medical school. I didn't do that. I always have just been fascinated with that sort of thing. So when I did see a position open up, I saw a position available, I really kind of started thinking like that would, seriously, I would love doing that. So that's kind of how I decided to do the OR. There's a long version, but there you go. One thing I want to talk about, and I get this question a lot, not just from like OR nurses, just your first day at any job, or especially a nursing job, on how that goes. I've done it twice now this year, been the newbie and not knowing anybody, and of course I was nervous. I was very nervous, but you just kind of, I think the second time around, I was more kind of just like accepting it for what it is and kind of going with the flow. I am a little bit more of an anxious person, I guess, but honestly, I just kind of went with it, just made sure to introduce myself to everybody, say hi to everybody, and that kind of helps. Like if you ask questions and you introduce yourself, you can really start feeling people out right away to kind of see, you know, who you can kind of interact with, and that will kind of almost help you ease your jitters. If you were hired at the same time as somebody else, or there's somebody else who is a recent start, try to see if you can kind of chum it up with them, because it's really nice to have somebody who you can kind of bond with throughout that experience. Those are kind of my tips. Kind of went through that. Just try to just be friendly, and that's really, you can't go wrong. Your jitters will subside. It does kind of suck in the beginning, being new and not knowing anybody. And with that, I'm gonna kind of go into the transition, going from the floor to the OR. I am I've only been doing this for about a month, so obviously I don't have a ton of experience, but I kind of want to talk about the work transition, and I also want to talk about the home life transition. I'll start with the home life transition, I guess. And a lot of you guys have noticed that I am looking and feeling much better and healthier, and you guys are absolutely correct in assuming that. If you haven't been following along on my nursing journey, I really struggled on night shift, and to be perfectly honest with you guys, I went through a very dark period. Probably the first, honestly, it wasn't until my last month on nights. So I worked from January to August, so 7 months-ish I worked on nights. I really only worked night shift from about the beginning of April until August, so it wasn't the full 7 months because it did orient during the day for a couple, I think it was 2 months. And it wasn't until that last month where I was really able to better balance it, but that is a really, really long time, and I still wasn't 100% happy, if that makes sense. And there were several months in there where I was very depressed. I felt like crap all the time. I would basically kind of hit these walls. I was at a birthday party out of town, and I had to go sleep in my car because I felt so ill, and that kind of like subconsciously made me afraid to make plans. So I didn't hang out with anybody, and that was really hard on me, obviously like emotionally and mentally. So that was a struggle. With me being on days, I am a true morning person. As you guys know, I get up at 3:30, 4, sometimes 3. It depends on how much I want to run that day, but I'm a morning person. I love it. That transition has been amazing. My kids have been so happy. My relationship is better. Not that it was really bad. Charlie and I we work as a well-oiled team. We really do. We've had our ups and downs, especially more in nursing school, but we've really kind of like learned how to work as a team, and that was really beneficial. However, we're so much happier. We get to spend so much more time together, and I've definitely noticed that in our relationship, that we are just like, it's been wonderful, honestly. Yes, I'm very, very much happier, and yes, I'm loving day shift, you guys. Like, 2 thumbs up from this gal. Moving on to the work transition, I feel like a new grad. I basically know practically nothing. It's definitely interesting. It literally is like being a new grad all over again. And the thing about the OR is I really only spent, I think it was a morning at an outpatient surgery center, and I think I mostly saw cataract surgeries. So that was the most exposure that I had to surgery prior to coming into the OR. I mean, obviously I had a basic understanding of like aseptic technique, sterile gloving, sterile gowning, things like that, but not really any clue. And there's so much that goes into the operating room. It's ridiculous. That's kind of how the transition has been going. I have a long journey ahead of me. For those of you that don't know, the orientation process in the operating room is 6 to 9 months long. I know. It is even daunting to me. I've been working as an OR nurse for a month, coming in with a little bit of experience, and I still feel like I'm at square one, like straight up. The reason that our orientation is so long is because you have to go through a program called Peri-Op 101. It's basically I don't even know how to explain it. It's basically kind of like a class to prepare you for the operating room, and at the end of it, you have a test. Yeah, here I am like, got my NCLEX done, girls done with testing, unless I obviously go back for my master's, but no. So AORN, I don't know, it's like the Association of Perioperative Nursing or something like that, Perioperative Registered Nurses, but basically AORN is basically like the big dog when it comes to OR nursing. And so basically I have to do all of these modules on the computer. It is ridiculous. So I have all these modules on the computer, plus I also have in-person educational sessions with the educator. So that's intense. Typically you have, like, I think they want me to have my Peri-Op 101 done within 3 months. I've already done 1 month of that, and I still have quite a bit to go. So that's the first reason why the orientation is so long. The second reason why the orientation is so long is because, like I said, you learn absolutely nothing about operating room nursing at all in school, really. Like very simple basics. Maybe malignant hyperthermia is like it, other than the stuff I already mentioned. So that's another reason. It is a completely different ball game. Like we are in a whole different ballpark, like a different sport, you know what I'm saying? Like it's its own thing. And the third thing that I can think of is when you are in the OR as a nurse, at least at my facility, you're the only nurse in the room. So you have, I mean, this can vary so much by who's in the room, but I'm gonna give you kind of a general idea of who is definitely going to be in the room. So you're at least going to have one surgeon, obviously. You are going to have at least an anesthesia provider, whether it's an anesthesiologist or a CRNA. You're also going to have a scrub tech, which is at my facility, surgical techs. I don't think nurses really scrub at my facility. I think some do, but they don't really train you, which I was kind of bummed about because I think it would be kind of cool to scrub, but it is what it is. And then you have your nurse, basically your circulating nurse. So that's kind of it. You're pretty much it. So you really have to know what you're doing. So basically my orientation consists of this Peri-Op 101 situation I'm doing, time with the educator, and then I also have OR time. So I do spend some time in the OR as well, although it's kind of been pretty much 50-50. So I haven't been in the OR as much as I would like to be in the OR, but I have been in there just kind of getting an idea of the flow and things like that. So it's a lot of orientation, but honestly, you need it because like I said, like once you start taking call, like you are SOL. Within 6 months, I will be working days on my own, but I won't be taking call on my own for an additional 3 months, which will be the 9 months, if that makes sense. A lot of people have been asking the types of surgeries that I see, and the one thing about, I don't know how to say this, I don't want to like come off like rude, but a lot of people that think about OR nursing, they're so focused on the surgeries, and I feel like even people that go into interviews, they focus on the surgeries, but really what you need to do is you need to focus on what the circulator is doing, what the nurse is doing. And yes, there is plenty of time that I get to watch surgeries, but in the same respect, I'm also trying to pay attention to what whoever I'm with that day is doing, because there's a lot of things that you're doing. You have to go grab things that they need, maybe on the field or whatever. So, and obviously there's charting as well during the surgery. So I have seen a handful of surgeries. I've kind of been able to bounce around in some of the rooms, and I've seen quite a few things. I've been in GYN cases, hysterectomies, DNCs, I've been in lap appies, lap choles, lap inguinal hernias. I don't even know if that's inguinal. I don't know, it's a weird word. But hernia repair. I mean, I've been in so many. I was in one where a peritoneal drain was placed. I was in for an aneurysm repair. I mean, it's a broad thing. I was also in for like some ortho stuff. The only room I really haven't spent much time in, which is kind of funny considering I have a daughter with neuro conditions, is neuro. And I'm okay with that because neuro just seems like its own beast. So I'm a little nervous if I'm gonna like neuro. I've seen a little bit of everything basically. And obviously on call you're gonna have traumas and things like that. So that's kind of the surgeries I've seen, but so far I've kind of more been focused on what the nurse is doing versus the surgeries, if that makes sense. You're not scrubbed in as a sterile member of this. Like when I refer to the field, I mean the sterile field. So like I'm not scrubbed in or anything. I am like off to the side, not sterile, so I can run and grab things that they may need on the field. That's kind of like a little bit of an overview of my first month. I don't feel super comfortable with anything. I spent a lot of time in an office, which this week is pretty much my last full week in the office. Pretty much from here on out, I am going to be with a primary preceptor. I will be with several different people, and your girl's gonna be learning some more stuff. I'm excited. All right, now I wanna get into your questions that are a little bit more specific than the broad overview of stuff I just did. One of the first questions is tips for students wanting to go into the OR. If you are a student, try like hell to get an immersion, which is typically your last semester of nursing school. Try to get an immersion in the OR, obviously, because how will you know? Unless your school has some sort of OR rotation. Ours was pathetic. Ours was not even a full day in the operating room. And like I said, mine was in an outpatient facility. I work in inpatient OR, so I've got all your big gun surgeries, you know what I'm saying? So definitely try to get an immersion. One thing that I never knew was even a thing is you can become an ORA, which is an operating room assistant. I don't believe that they are CNAs, but they function kind of a lot like CNAs. But an ORA is an OR assistant. Basically, they assist in transferring patients from the cart to the bed and back and forth. They help with positioning. They clean the rooms. They run specimens. It's kind of like a CNA, but in the operating room. So if you have that ability to become an ORA, that's a really great opportunity to get yourself in the OR. And you're probably more likely to get hired into the OR if you have that experience. If you're unable to do any of those things, ORs typically, like if you have spent some sort of time in critical care, like the emergency room, ICU, something like that. Next up, am I worried that I'm going to lose my nursing skills? I'm really not. Do I think that I will lose some of them? Well, yeah, if you don't use it, you lose it. But the thing is, think of how much time you spend in nursing school doing these skills. You do it on a mannequin for maybe 3 days so you can pass your skills, and then you don't do it again until you become a nurse. Skills are something that you can relearn. I mean, you can really teach skills to anybody, honestly. It's more like the critical thinking and obviously your basic knowledge that you learn in nursing school that I think is so important. So am I a little bit concerned about it? Well, yeah, I'm a little bit. I mean, obviously if I'm not as fresh on my assessment skills, I am a little bit worried about that because that's something that really comes with practice. However, I am very grateful that I did choose to spend some time in med-surg to kind of hone on those skills and kind of know what to look for, and I'm just grateful for that experience. Do I miss patient interaction? Yes and no. I do get a little bit of patient interaction with my patients when I go and get them in prep and kind of when I'm taking them into the OR. It is a very short period of time where I'm trying to basically build that relationship with the patient. I think I'm a pretty personable person. I think it goes pretty well. The one thing I do miss is, it sounds really bad, but there's not that many instances in my 7 months of nursing that I didn't have a whole lot of warm and fuzzy moments. I did have a couple, don't get me wrong, but I did have a few, I should say few moments in nursing that really reminded me on why I became a nurse. And that part I kind of miss, but I also do like being able to comfort patients before surgery, because surgery is really scary. So I do get like a little bit of that. Is there a certain personality that fits the OR best? I think no matter what personality you have, if you want to do something, you go do the damn thing. But I will say that a strong personality is definitely beneficial in the OR. In the OR, you have personalities. There's a lot of extroverts, which is good, but you also have to be able to stand up for yourself. Not only yourself, but also your patient. The circulating nurse, basically your job is to advocate for the patient, and I have heard stories where the circulating nurse has had to advocate for the patient, and you have to be able to stand up to a surgeon and anesthesiologist in stressful times, and I have heard of obviously both of those yelling at nurses. So you really can't be offended easily. You really have to just kind of, you gotta be able to stand your own. So that is definitely a beneficial thing, but don't worry, honey. If that's not how you are, you can learn that stuff, it's fine. Will I stay in the OR forever? I feel like people think that once you go into the OR, you're like falling off the face of the earth and you aren't ever gonna do anything. I don't know. Being a circulating nurse will not be the end of my journey. And a lot of people kind of ask, you know, I've had people ask if I plan on going to grad school. Yes, I definitely plan on going to grad school. However, things change. I thought forever I was only gonna be a peds nurse, that's it, that's all. Look where I am now. Totally not a peds nurse. I mean, I do work with pediatric patients in the OR sometimes, but that's besides the point. Since being in the OR, something that really interests me is I think I might go to basically be a surgical nurse practitioner. So I could basically assist the surgeon in surgeries, because that's what your girl wants to do. So eventually, after I do this for a long while, Charlie wants to go back to school, so he's gonna do his school thing. And then we'll see where I am, you know, in 3 to 5 years, see if maybe that's still something I'm interested in, or if I'd rather be a nurse practitioner in a, you know, clinical setting. There's all that. I don't know the future, you guys. I don't have a crystal ball. A big question I get is, do I get nervous, nauseous, dizzy, lightheaded? Basically, am I squeamish? And I am absolutely not squeamish, not in the slightest. They actually asked me that in my interview. I was like, I don't think so. And then like that week, I basically had to pack a wound, a stage 4 pressure ulcer, where I could see it was huge and I could see their bone. And I was like, not squeamish. And I still have yet to feel squeamish. Somebody asked me what my favorite and least favorite thing about surgery is. I think my favorite thing is just learning about the surgeries themselves, as well as anatomy, because it's just kind of cool, like actually seeing like, oh, the gallbladder's under the liver. That's a liver. Like seeing the liver like up on the screen, I think that's like the coolest thing in the whole wide world. Least favorite thing is honestly the same BS that you have in any nursing, and that's just when you have people that just aren't nice for no freaking reason. You have people with egos everywhere you go, whether you work on the floor, they're everywhere. That's my least favorite part. I don't think it's specific to the operating room. I think that's everywhere. You might have a little bit more of it in the operating room, just because you do have, you know, your surgeons and your anesthesiologists, but I have personally not experienced anything negative from them. Just, I hear the talking in the break room, so I'm sure it will come. So I hope you guys really enjoyed this video. I really tried to plow through that so I can go hang out with my fam bam, who is so patiently trying to be quiet in the kitchen with the door closed. So my camera just died, but thank you guys so much for watching this video. If you guys have any questions that I didn't cover in this video, leave them down below. Also let me know if you would like me to share my experience throughout my orientation journey. I will still make videos about floor nursing, because I know that there are a lot of you that work on the floor or will be working on the floor, so that is definitely something that I will do as well. Also sharing what's going on in my life, which is being an OR nurse. So I will catch you guys later. Thank you guys so much for your wonderful questions, and thanks for watching. Catch you guys next time. Peace. And Charlie's home. Do you guys need help? I'm filming a video.
Hello.
Charlie just picked up Delilah. We're gonna go grab Winnie, and then, I don't know. I wonder if I should finish filming this now. You can sit with me, but you have to be really quiet so I can talk about this quick before I have 2 kids. 2 crazy kiddos, okay?
2 crazy.
Why do you have, is that an ice pack?
For my butt.
What's wrong with your butt?
I fell on hard ground. But now it
On your
doesn't hurt.
tailbone? Okay.
On this bone.
Yep. Well, that's kind of your issue.
It's just my butt.
Your ischial tuberosity. Anywho,